Hello again, and welcome to this lecture on language and literacy. So what I want to talk to you in this lecture is about listening, some of our results in listening, vocabulary, or speech perception, I should say, in terms of listening, vocabulary, and literacy from school-age children. This is based on a small study that I did with my colleague, who's the psychologist on our cochlear implant team. We were really interested in how are kids doing. And here's the objectives here. And so I just want to give you the impetus for this. I should back up a little bit and say the impetus for this particular project was that we were having to make some challenging, and I say we sort of collectively, we with parents, audiologists, therapists, we're having to make some sort of fairly tricky decisions some time back and even now with regards to candidacy for cochlear implants. And so the issue is clear. When we have a child with a profound hearing loss, we've got reams of data now, and we know that the child is going to profound hearing loss. We're going to benefit from a cochlear implant. We just can't provide reasonable access to sound with hearing aids anymore. But when we have, there's this borderline kind of severe hearing loss category where we kind of go back and forth and they kind of gnaw at us and we're like, oh, what to do and should we wait? And teachers in school will contact us and say, I wonder if this kid would do better with a cochlear implant. And we still don't have all the answers, but we're continuing to sort of accumulate information to get a better idea of sort of, what's the equivalent hearing loss for cochlear implantation, what level of hearing loss is equivalent to what a child would obtain with a cochlear implant. So that was kind of the impetus or the motivation for the study, but what I want to use it for is to talk to you about how these kids were doing in terms of their language and literacy development. There were two study inquiries. I won't spend much time on the first, but just a little bit, and more on the second. We wanted to, as I said, determine current decision-making practices. And we undertook a national study, just a little survey of all the Canadian centres. The way we're organized in Canada is that we have 12 pediatric cochlear implant centers, and we wanted to see who would they implant and who would they not implant, because we found sometimes that parents were doing a little bit of shopping around because child might be not considered, not accepted as a candidate in one center, and so they'd kind of consult with another center. So we were kind of struggling with this a little bit. The other thing we wanted to do was to examine outcomes in multiple domains in children to sort of get a better snapshot of what can I expect of a child with a severe hearing loss, what can I expect of a child with cochlear implant. And this was a few years ago, and so children weren't being implanted quite as young as these days, but I think it will give you a good overview of what was happening. So as you know, at least when I started in cochlear implants in 1990, we were really implanting only the very deaf child who had sort of left-hand corner audiogram or almost no measurable hearing, or as we would kind of say, a couple of dots on the audiogram. Then by 2000, we were implanting children who had what we'd call hearing across the board. Even though they had some hearing in the high frequencies, it wasn't very good, but it was what we would have killed for before. We would have loved to have had that in the days before cochlear implants. We saw that as kind of a bonus if we got something in the high frequencies to give them access to those high frequency phonemes. So we started implanting kids sort of across the board, who heard across the spectrum. And then, as the years have progressed, we're now implanting children with more severe hearing losses and children with sloping audiograms who have mild or near normal hearing, in some cases in the low frequencies, but who really need that edge, that extra access to information in the high frequencies. So things have evolved and changed a lot. So just to set the context for that. We know that cochlear implants have substantially improved the potential for children with severe to profound hearing loss. But as I said, just to reiterate, the point at which a cochlear implant, I think that's the real question, at what point is a cochlear implant going to provide this kiddie with a bit more information to continue his language and literacy development? For those kids who have the severe borderline hearing losses. And that's really unknown. I think it's still unknown, and it's going to be based on a number of factors, as we'll see in a couple of minutes. In our little survey, we said to people, what do you consider to be borderline hearing? And it was very interesting that in the same country, each center, each province, each center sets its own protocols, but I would have thought that we would have had more of a consensus, and it may be that we do now. This was back 7 or 8 years ago, but we had some people who said, well, I'd consider 90 dB to be borderline. Others who said 80 to 85. We had them do a little check on our form. 75 to 80. Some said 65 to 70. So I mean, the message there was that people really aren't sure, and there's a real difference of opinion about where a cochlear implant can provide better hearing support than a hearing aid. And I think there's still some unanswered questions, but I think we've become more comfortable with implanting those kiddies more in the severe hearing loss range nowadays. One of the things that we did as part of this study, in addition to the survey of the centers, is we did some focus groups with teachers, with audiologists in our clinic, and also with teachers. We went out and we said to them, because a lot of times what was happening for these more borderline cases is that these were kids out in the school system, keen visiting teacher, or we call them itinerant teachers, would refer the child back in for a cochlear implant assessment because they were concerned about something, typically. Or they got a kid with a cochlear implant on their caseload and said, wow, this kid is doing marvelously and hearing everything, and this other child who has, 70, 80 dB loss is really struggling. So we talked to them about how they were making those decisions, because in large part it was coming from them. And so they told us about the things that they considered to be important in decision making, not just the measurable hearing on the audiogram, which of course we know is very important, not just the speech recognition scores, which is the test we were doing in the hospital, but they told us about the kinds of things that were meaningful to them as teachers that resulted in their talking to the parent, referring the parent into the cochlear implant center, and many times we encourage them to accompany the child in for a candidacy assessment. So you have them around here. They said things like how the child's doing in spoken language, how he's progressing in his therapy, how he's doing socially. Is this child connected? Is he feeling comfortable with his peers? Is he talking? Is he part of the group? They talked about literacy and academic functioning as being something that they took into consideration. They talked about, I'll come back to age in a minute, they talked about the child's, I remember one therapist talking about sort of, just the personality, the behavior, the changes that she'd seen when some of these children got cochlear implants. She said, now I really take that whole behavior component into consideration. A number of them talked about the efforts that these children have to make, especially in distance listening. One of the big factors, at least for the clinical people, was the age of the child. They just felt more comfortable once they had a child who was old enough where they could, one audiologist put it something like, if I could just measure something, I need to, and that's the clinician in me, I need to have something measurable, I need to have something on paper, it can't just be observational. So what we started doing is really taking that whole package of information together to help us in decision making, including the literacy and functioning. Okay, so here are the characteristics of the children in this particular study. I'll move on now to talking about our results briefly. So these kids were, so we divided them into our hearing aid group, which were the kids who had severe hearing loss. That was the inclusion criteria to be included. You had to have, I think we defined as 70 dB or greater hearing loss, and the children who had received cochlear implants already. So those were typically the children who had a 90 dB hearing loss or greater. In some cases, we might have had a few borderline kids more in the sort of 85 dB range. We had 20 children using hearing aids, 21 using cochlear implants. They had an average age, the hearing aid kids were just a little bit older, and that's just the challenge of recruiting kiddies that are similar. They were about 12, and the other group was closer to 10. And I won't go through all the details in the table here, this is more for your own information, but not surprisingly, the age at diagnosis of the children who had cochlear implants, because they had more profound hearing losses, and some of these were before newborn hearing screening, because these were school-age kids, range in age anywhere from 6, 7 to, we had a couple of, I think, 16, 17-year-olds in there. The hearing aid group had an average of 68.7 decibels, pure tone average, and the cochlear implant group an average of 100 decibels. And so I think that you've got the essential information there on the slide. They received their cochlear implants. The cochlear implant group received their devices on average close to 3 years of age, which was fairly typical for the time. Obviously, there were kids in there who had a cochlear implant at 1, 1.5, 2, but on average, because some of these kids were coming back to us once they were in school and someone was more concerned about their performance, their functioning, with hearing aids. So some of these kids got implanted a little bit later. So we did assessment measures in multiple domains, and I won't talk in detail about all of them, but we had speech recognition measures. How well do they understand speech? We brought them in, we tested them in the sound booth. We had vocabulary measure, the Peabody Picture Vocabulary Test, various language measures, speech. We used the Goldman-Bristol Test of Articulation, and we also had literacy. We had both phonology and some scores in word reading and spelling and so on. And our psychologist did a cognitive assessment on all of the children using the Wechsler Intelligence Scale for Children, because we wanted to ensure that our groups were comparable in terms of their cognitive development. So here's the scores from the intelligence tests, and I see this as less of an outcome score, but more kind of a characteristics of the children. And so the children with hearing aids are in the blue bars, the children with cochlear implants in the red bars, and what you see is they were pretty evenly matched. There was a slight difference there in verbal comprehension, with the hearing aid kids being a little bit higher, but overall in everything else, in nonverbal, all the nonverbal areas, these kids were pretty evenly matched and comparable in terms of their intelligence, which is important because we know that can make a difference. So let's take a few minutes and look at some of the scores, and it'll give you an idea of where these kids are at and what we might be able to expect. So here are speech language results, and the test names are on the bottom along the x-axis there. We have the receptive vocabulary with the Peabody, the clinical evaluation of language fundamentals, the self, and speech we use the Goldman-Bristol Test of Articulation. In retrospect, might have not been the best measure, but it's what we use at the time. And what you see, I'm going to work backwards here, starting with the Goldman-Bristol Test of Articulation. In terms of articulation, you can see the green bar being the hearing aid children, the blue bar being the cochlear implant children. We saw no difference. They were both coming in at close to that 100. So, and I should remind you that the mean for all of these tests is at 100 with a standard deviation of 1. So these are all tests, all standardized tests with normative data. When you look at the, right over to the left now and look at the Peabody Picture Vocabulary Test, we did see a difference between the kids with hearing aids and the kids with cochlear implant. Kids with hearing aids were closer to that mean of 100. Cochlear implants, they were below the 80 mark. They weren't doing so well in their receptive vocabulary. In terms of the self, very similar pattern. We had better scores in language for the kids with hearing aids than the kids with cochlear implants. Largely, that's going to depend on your groups. At that time, we tried to recruit as many children as we could for this study within the scope of the funding that we had available for it. We were able to get these 20 children with severe hearing loss and these 21 children with cochlear implants who participated. And I think that just happened to be the makeup of the kiddies with cochlear implant. I don't think that's necessarily reflective all the time of how kids with cochlear implants would compare to kids with severe hearing loss. But that's what we found in this particular group, particular cohort, coming from the same era, if you want, in the same clinic, in the same kind of school settings. And these, I should add, these were all kids who were integrated into regular classrooms with visiting teacher support. So that's the speech language piece. Let's move on to speech recognition. In speech recognition, we did the PBK, phonetically balanced kindergarten words, so monosyllabic words where they have to repeat things like need, tree, bed, those kinds of things, very commonly used tests. PBK words, we did the PBK phonemes. We did hint sentences, hearing and noise tests, but we did it in quiet. We also did it with a +10 signal-to-noise ratio, +10 signal-to-noise ratio and a +5 signal-to-noise ratio, so more difficult listening conditions, and you see the difference in the scores there. Again, the children with hearing aids, the green bars, the children with cochlear implants, the blue bars, but what you see is there were no significant differences in any of the scores. So if I had to just talk about their ability to hear or to recognize speech, these were all administered using recorded voice, not live voice. These kids were coming out to sort of in the 60 to 70 range with PBK words, more in the sort of 80 to 90 for sentences, and they were all hearing pretty comfortably. So their hearing looked the same, but remember on the other slide I showed you is their language was looking somewhat different. So the hearing piece doesn't tell, interesting enough, doesn't tell the whole story. Are there relationships? Yes, of course there are. There must be. But it's not as clear cut. Here are the phonologic and literacy results. So for the phonology, we use the CTOP, which is a test of phonology that's become very popular. And the three categories that we looked at were phonological awareness, phonological memory, and rapid naming. So repeating digits, that kind of thing, with 3, 5, 7, 9, 8, as rapidly as they can. When you look at the scores, phonological awareness, we didn't see a difference. Again, test means are 100, with the red line you have there. Phonological memory, we did see some differences, with our kids with hearing aids, again, being consistently higher than this particular group of children with cochlear implants. Rapid naming, no differences. In literacy, we had word reading from the Wechsler Individual Achievement Test. We had pseudo-word reading, so made-up words. On those two measures, our kids scored very similarly. We had a spelling subtest from the Peabody Individual Achievement Test, again, very similarly. Where we did see a difference, and a fairly significant difference, was in reading comprehension. And again, that may be reflective of the fact that the kids with hearing aids were perhaps overall a bit stronger in terms of language acquisition in this particular group of kids. Because what we saw is very close to the norm, the test norm in the gray silent reading test for the kids with hearing aids, but quite a bit lower for the kids with cochlear implants. And so that particular test was, the children would have, it's called the gray silent reading. The children, I don't know if some of you may be familiar with it, but the children would have to start out reading a very little easy passage, a little story of 4 or 5 lines, and there would be questions that they would have to answer about it, content kinds of questions. And of course, the easy ones are sort of easier in terms of sort of more, the content is more explicit. They're easier questions. What was the dog's name? What did mommy buy at the store, that kind of thing. And of course they get progressively harder, where the questions are more kind of inferences, more thinking questions. What do you think he might have done? What might he have done? Et cetera, et cetera. So those kinds of things where they had to think a little bit more about some of the responses. But that was interesting, an interesting finding, and not necessarily a finding that we expected, and I think particularly because they were so even and so equivalent on some of these other scores. So kind of like we say, don't judge a book by a cover. Let's look at the big picture. Let's look at how these kids are doing across domains, and just because they come into a clinic and get 80% or 90%, just to go back to that for a minute, if you look at 80, 90% on the hint sentences in quiet, doesn't mean that we're not going to have challenges in other areas of functioning. So let's really keep on top of things with these children. I think that's my main conclusion. The main take-home message from this talk is that despite the fact that hearing looked the same, it looked like they were hearing the same way, children perform very differently in some areas of development, notably in some aspects of language, in receptive vocabulary, in phonological memory, and in reading comprehension. So really important to look at the big picture when we're talking about these children, look at all of these different areas of their abilities. To conclude, children with moderately severe hearing loss can develop spoken language skills similar to their normal hearing peers according to test norms. Again, we didn't have a normal hearing comparison group here. Our normal hearing kids may have been higher. We don't know, but according to test norms, we were pretty comparable to normal hearing kids. In terms of hearing aid versus cochlear implant comparisons, speech recognition not different, but significant differences on some, and I stress some, only on some language measures. Good spoken language skills, for the most part, align with good literacy skills in most, but not all children. Here you're looking at the group data and not individual data, but if you look at individual kids, we don't always see that kind of nice one-to-one lineup, unfortunately, in a way, because sometimes it makes our job harder in terms of figuring out what's going on with this particular child or who's going to have difficult. And in terms of our other question with regards to who's a candidate for a cochlear implant, our feeling from this study, and particularly from our survey and from having talked to the teachers who are out there in the real world and observed these kids functioning in the real world, is that the evaluation for these more borderline kiddies should extend well beyond the audiogram and speech recognition assessment, and we really should look at multiple domains, multiple dimensions of the children's functioning when assessing children who have some residual hearing. So here are a few suggested readings for you that you can have a look at if you're interested in looking into the study a little bit more. And again, I'm going to wrap up here. Again, I want to thank you for joining us in this online series. I hope maybe there was a little bit of useful information that you gleaned, perhaps a tidbit of something that has kind of made you go away and reflect and think about some of the differences that we see in children with hearing loss in terms of language and literacy. And I hope you will, and I know that you will, think of sort of the big picture when we're looking at these kids. So again, thanks for joining in, and we look forward to seeing you again soon.